Hi everyone, good evening. My name's Gemma Miles, and as Nikki said, I'm a level 2 hypopressives trainer. I'm also a soft tissue therapist, and what I've done is combine the two together, and that's what I'm going to talk to you about today. So, predominantly now, my soft tissue therapy business is focused on women's health, and a lot of it is around fascia and scar tissue. So that's what we're going to talk about tonight. And I've got some cool things to show you to maybe get you having a go at yourself if we have the opportunity. So it's going to be a bit of an interactive session. And we're going to have loads of time at the end for questions, although I'm quite happy for you to pop something in the chat as we go. I'll try and keep an eye out for that as well. Okay.
So shall we start with what exactly is fascia, Gemma?
Yeah. So I know this is a subject which you love, Nikki, so I would love it,
Rightly.
chime in as well. Um, I think you're a soft tissue therapist as well, aren't you? Like
Yes. Not
today.
that I use it. I don't use it at all.
No, but you have a background in it. So I think, anyone who is working with bodies on a regular basis, you start understanding anatomy, and then the more you see bodies, the more you see how differently they are, different movement patterns, things like that. And for me, doing lots of massage, doing lots of manual therapy on people, you feel different things in different people. And we hear this magical word fascia all the time without really understanding what it is. Um, so just to give you a bit of an idea, if you imagine, building a body from the inside out, we've got a skeleton right in the center, and that gives us structure. It gives us something to stop flopping around all over the place. And then stuck to all of that, around our vital organs and things like that, we have muscles, we have tendons and ligaments that hold our skeleton together, attach muscles onto the skeleton. But around all of that, we have this connected web of stuff that brings everything in our body together. And it has nerves running through it. It goes into our endocrine system that produces hormones. It connects our gut to our brain. And there are all sorts of connections going on, and layers as well. So when I think now about a body, I don't think about an isolated muscle or an individual tendon or something like that. I'm thinking about the body as a whole because it works that way. It doesn't work. I don't move one thing in isolation. And if you think about a tablecloth on a table, and you kind of pull the tablecloth from one end to the other, it will just slide around nicely on the table like a layer of fascia. So our skin, or layers of fat, or layers of muscle, they all kind of slide around on top of each other. You pull one bit, and it pulls the next bit, it pulls the next bit. If we have a healthy fascia, then that's what's happening. I've got my daughter's little baby toy here. She's not
Oh,
quite a
I
baby,
want one of
she's
those.
just 3. So I've kind of stolen this now. But this is a little model that helps you kind of visualize it. We've got the skeleton in the middle, which is the wooden sections that give us structure and shape to this little toy. And then there's bits of elastic connecting one bit to the next to the next. And at the moment, this is nicely, like, it's got a nice even shape, sort of geometric shape. It's nicely moving, it's squishable, it's movable, it goes all over the place. But if I were to scrunch up one part, then it would be misshapen. It wouldn't really bend as well in certain directions. It's quite stiff around here because I've stopped this part from being stretchy. And that is what goes on in our bodies too. So what I first want you to get your heads around is the difference between healthy fascia, like we've just described, that's nice and flexible and stretchy in all directions, and unhealthy fascia, which is restricted and can't move as well. And how that might affect our movement patterns, our body's pain levels, and our breathing patterns, maybe the way that we just feel inside. And if we think about that and how that might affect our understanding of hypopressives and women's health, then that's what we're here to talk about tonight. Water.
Not wine, that's afterwards.
Yeah, I've got my glass of wine in the fridge. So if we look at hypopressives and how that works on fascia, Nikki, you're brilliant at explaining this in your training courses, so I hope that everybody's got a basic understanding of this already anyway. Just a bit of a recap here. We have the core in its full form really is, I'm going to just stand up a bit so you can see my body here. We've got our diaphragm under the rib cage. We've got our abdominal muscles wrapping around the center of our tummy here. And then we've got the pelvic floor underneath. And when we talk about hypopressives, we're engaging all of that at once. So when we do our vacuum, we are creating movements within the core, the pelvic floor and the diaphragm, and the postures layer on top of that additional movement through the body, because we're in slightly different positions, we've got slightly different directions of tension going through the body. So fascially, as we do a vacuum, we are getting a stretch or a movement through our core fascia, our pelvic floor fascia, or if we've, as we bring our arms into a different position, we've got tone going through the arms and diagonally, maybe up and down through the back whilst we're leaning forward slightly. When we're sitting and we've got that slightly, well, we've got a very vertical position with the back, but it feels a little bit like we're leaning back, and that is working through the front of the body. So you've got all these different lines of tension going through your fascia as you work. So that's why hypopressives is great for toning fascia and getting movement through these different areas of connective tissue that need to move.
So I've got a question. So if you've got unhealthy fascia, how does that affect the pelvic floor and the core?
So if you think about what can happen to fascia to cause a restriction or a stickiness, we've got our fascia, and we could directly affect it by maybe having scarring. So if you've had surgery or a birth injury, such as a tear or an episiotomy, then that scar tissue will repair itself and usually will form in a bit more of a stickier way with the different layers of fascia that it where the injury was. So if our nice layers of slidey connective tissue all sliding over the top of each other, I'm just letting someone in, sorry. Those slidey layers will be a bit more stuck together in those areas where there is a scar. We might also have fascia that's indirectly affected, pelvic floor fascia that's indirectly affected because it's something close to the pelvis, maybe the hamstrings or your adductors or your hip flexors, anything that's connected to the pelvis and has the same kind of connection points as the pelvic floor, that might be affecting the fascia around your pelvic floor as well. We also might have abdominal scarring or injury, like a abdominal separation, and that might be affecting your fascia. And so all of this unhealthy fascia, there'll be restrictions or a lack of movement or a lack of tension maybe. And if that's the case, then your pelvic floor is not going to be as responsive as ideally we want it to be to give us a nice, healthy, responsive set of muscles in our pelvic floor that support all our pelvic organs. Did that?
Yeah.
Question,
Yeah,
Nikki?
cool. Absolutely.
So another thing that affects the our understanding of fascia and what we want it to be doing when we're teaching somebody hypopressives is fascia could be causing some restrictions, say in your back. Maybe you've had back pain for a while, you've got very tight muscles in your back, so they're not really stretching, and that affects your rib cage and your rib cage position. Maybe you've had poor posture for a long time and your breathing patterns are a bit weird, and so we've got restricted tight areas around the rib cage there that are stopping us from getting that lateral breath that we really want to get the diaphragm working and a really great apnea. If we look at how much scarring and or pulling in the pelvic floor, scarring around the C-section area, hysterectomies, things like that, how much that, if we look at how much that can affect the lack of responsiveness in the pelvic floor, that is a significant factor in prolapse as well, and the severity of prolapse symptoms. So we'll be doing all these great hypopressives, and we've got our clients and they've learnt the flow and they're doing all of their practice. But what I want to talk about is what happens if we could do a bit more, because there is some of this restriction there that stops somebody from being able to really open up their rib cage as much as perhaps they could otherwise. Perhaps if they've had a C-section or a hysterectomy, let's explore whether some restriction in the abdominals or the C-section area is stopping us from getting as much benefit from the vacuum as possible. Because if we can directly affect how that scar feels, whether it pulls, it doesn't pull quite so much, that's going to have a better effect with the vacuum, and therefore you're going to get a better result from your hypopressives.
Yeah.
Does that sound cool?
Yeah.
I think it's really cool.
I mean, the lateral breathing as well is such a big part of that, isn't it? And if we can get someone actually moving their ribs more and breathing better, then we know that that affects the diaphragm and then best friends with the pelvic floor. And so that, you know, there's always this kind of knock-on effect. So if we can improve the fascia, then that's absolutely amazing.
Yeah, and I think actually rib cage wise, I probably see, so I see a lot of ladies who come to me with C-sections or hysterectomies, and we work on their scar. But when it comes down to it, what seems to make the biggest difference, and what really a lot of people come to me with, is like kind of slightly flared ribs.
Yeah.
And then if they're, what I mean by a flared rib, let me see if I can kind of demonstrate this. If we've got a slightly kind of arched back position, different postures, and we've got a more open rib cage here, tight muscles at the back, then you're already a bit too open here, and it means that you can't get that great, lovely lateral breath that we want. And that, I reckon 50% of the ladies that I see need some work around that area just so that they can then start to breathe.
And that's just due to pregnancy.
quite often, yeah. Um, uh, Sometimes it's congenital. That's
Yeah.
actually really hard to deal with. But yeah, pregnancy with the sort of, the posture that you end up in the latter stages of pregnancy, there's no room, that you need to make your ribs expand to make room for the baby. You're trying to support this big weight, you're leaning back. Um, Quite often women kind of continue on with that
Yeah.
postural pattern after they've had their baby.
Yes, I know that because I've had twins, when I mean years afterwards I had my ribs adjusted without even kind of it just happened to be that a chiropractor said to me, "Oh my
Mm.
God, look at the state of this." And did some adjustments and helped me with that. But yeah, I mean it was a major player in back pain and pelvic floor dysfunction, etc. So
Mm.
um cool. Okay.
Yeah, I mean, if you don't fix that, then I think hyperpressives, yeah, we can keep doing that. But if at the end of the day your rib cage is angled upwards and it's at a funny angle compared with your pelvic floor, it's
Yeah.
never going to be working effectively
Mm.
the way it will if they're stacked over the top of each other in a nice solid way.
Mm.
So yeah, these are kind of ideas really to bring in maybe when hyperpressives on its own isn't perhaps working.
Yeah, absolutely. Well, um I tend to do get because I'm doing a lot of work online. I tend to do self massage stuff with people. I mean, I wouldn't go so far as to make them do their own adjustments. I'd obviously send them off to somebody, but I try and start the breathing off with doing some self massage because so that they get used to doing stuff themselves.
Mm.
Yeah.
So just one final thing before we talk about some techniques. So I just wanted to talk a bit more about breathing and gripping actually, because the
Yeah.
other thing that I think that we see a lot of, if especially with ladies who have a prolapse, they're walking around honest, literally trying to hold their insides in. If it can feel like that. I got into hyperpressives because I had a rectal prolapse after my son was born, and I know what it feels like. I literally felt sometimes like I was holding my bum in,
Yeah.
and I think that when we're walking around with that much tension, um, that in itself is creating fascial pull that we want to try and lessen. So, yeah, if you look at a person as a whole person and how they're standing, whether they're gripping, how they're breathing, as well as what's going on in their pelvis and those symptoms that they've come to you for, then we can start to unravel what's going on.
Well, that's exactly going back to that model that you showed where everything's connected. And that's why it's so important with what we do compared to generally what is given for physio normally, which is just focus on the area where there are the symptoms and don't look at the bigger picture. And I just think that's what kind of sets the work that we're doing apart is that we're working on the whole body.
Yeah. And that's why the detail, all those things that we're drummed into in our training about, your feet parallel,
Yes.
from your feet to the tips of your fingers,
Yes.
we're creating these lines of tension through the whole body. Uh,
Yeah.
so it's
Yeah.
really cool.
It
And
is cool. So what have you got next for us?
so okay, so what we want to really like the gold in this presentation really is to talk about how if you've got these stickier areas in the body, what can I give you that you could try, so that we can get things moving better so that the hyperpressives works better. And so that's what we're going to do. And so what time are we on now? We're at 8 o'clock.
We've got 15 minutes before questions, and at the moment we don't really have any questions, so
Well, that's good. You might
got
come up
lots
with
of
them when
time.
I start showing you stuff.
Yeah.
So I've got another I've got my phone set up on a tripod so I've got my treatment couch laid up. So I thought what I'd do is I'll show you some clearer pictures of me showing you what to do. So I'm going to switch cameras and we'll go from there. So give me 2 seconds. Oh, I've got a question. Let's have a look. Okay. So Matilda is asking about fascia and hormones. Okay. So that's a really good question. Fascia doesn't create hormones, but fascia and the systems in the body that create hormones, there is fascia linking all the way through those systems. So in terms of fascia being involved in sort of sending hormones around the body, that is the case. And so when you look at the changes that fascia undergoes when we get to perimenopause and pregnancy, as you see, then that, yes, absolutely, your fascia can definitely be changed just by hormones. If you think about during pregnancy, we have a lot more relaxin in the body, and so everything that's connective in our body gets a bit more stretchy, and we become a bit more hypermobile maybe. And perimenopause, again, we've got loads of changes in there and fluctuations in our hormones there, which again can have a direct impact on how stretchy or not so stretchy or hydrated our fascia is. Does that help answer your question?
Great question.
Cool. Yeah, it was a good question. That didn't cover that. Right. So I am going to place the spotlight, and you can see now my couch, and I'm going to lie on it there so that you can see me a bit better. Ta-da!
No. Yes, we can see you. That's brilliant.
Yeah, okay. So, I just need to get rid of a couple of messages there. So, the first thing I thought that I would show you, which would be handy, is thinking about the tummy, what it goes through during pregnancy, and some simple tricks that can just unstick this area of your tummy. So what I'm going to do is flashing my ribs there and just bring this down a little bit so you can see my tummy. Right, so kind of wishing I hadn't had so much dinner now. So first of all, let's look at pregnancy and the rib cage and what might be going on here. So if we've got slightly flared ribs, then you're probably going to see them kind of protruding a little bit more. I've got a more arched back here, and this is going to be quite open. So if I, from this position, try and do a lateral breath, I can't go very far. You know, it's already quite wide already. Okay, whereas if I set myself back down in my kind of normal position and I try and do a lateral breath, then I can go much wider. See, so if we've got any restriction here, then probably we've got some tightness up at the top here in the diaphragm up here, and we've probably got some tightness down your six-pack muscles, your rectus abdominis, either side of your tummy. So what I'm going to show you first are things that are pretty simple to do that you can teach your client how to do, or have a little go yourself. It is really handy to be able to do this thing on yourself so that you can describe it better. So I encourage you all to either do it now or maybe watch the recording later and have a little go. So my diaphragm is under my rib cage. I can feel my ribs here, and if it's nicely happy fascia, then I'm going to be able to get my fingers underneath. See, it's a bit tighter at the top here, where I feel a little bit like I'm being winded when I press here. So for me, this is quite tight. And then under this side, I want to push my tripod over, sorry. You can see my fingers will go underneath it, yeah? And that's not too squeamish, honestly, and it shouldn't feel tender or tight to do that. Now down here definitely feels fine for me, but under here feels a little bit sore. So what I'm going to do, and I'll probably just stick with one hand at a time, is just put a little bit of press into there, find a sore spot. I don't want to be too aggressive about this, but if I find a little sore spot, just like you might find in the back of your neck or your shoulder, all we're going to do is just kind of breathe into it and try and relax. And you just hang out here and slowly but surely these sore spots start to dissipate, they start to relax. You find a new spot. And if your client did this regularly for a little bit, just a few minutes a day for a week or two, then it might make a huge difference to how much movement you can get in your rib cage without really thinking about it. Right, so that's number one. And the next one is something which I think is really useful and super easy to teach people how to do. I find it especially handy for people who are struggling with diastasis recti. Now, Hypopressives is amazing for bringing our separated abdominal muscles back together. But sometimes we can give the body a little help, because if rectus abdominis are really tight either side here, which they definitely get after pregnancy, because our bodies have expanded and the muscles, we've got this separation at the front, and rectus abdominis out here are hanging on for dear life, holding everything in and trying to keep us upright and walking around. So after pregnancy, this is really, really sore, usually, and tight. And if they're tight, then it will be pulling the separation wider apart. And so we're doing our hypopressives to create a vacuum and bring things back together. But if it's all super tight, then you're kind of working against yourself. So this is what I do. So we've got your six-pack muscles. They attach to your rib cage here, the bottom ribs. And they go all the way down and they attach to your hips at the bottom, so your hip bones and your pelvis. And so all of this is fair game, either side of the midline, for a bit of massage, and it runs up and down like this. So what I do is I work from both directions, and I put a little bit of flat pressure down into the tummy. Can you see I'm not like pushing down into my organs? I'm pressing down flat, and then I'm pulling up from my pelvis a little bit. Now at the moment my knee is bent up here, and I'm just going to push it away. I'm going to slide it till my leg is flat. And when I do that, it creates this nice little direct stretch into this part of my rectus abdominis. And I can do that several times. So I put a little bit of a pull, so I'm pulling the muscle away from my hip, and then I slide my leg away so that it really lengthens that part of the muscle. Now you can do the same with the top part of the muscle as well, between, say, the middle where your belly button is and your ribs. And this time I would pull the muscle down away from the ribs, and then take my arm overhead and then maybe arch my back as well. So now I'm getting a stretch up from my thumb here up towards my ribs, especially if I take my arm overhead. So depending on whether it's tight and sore up here or it's tight and sore further down, you can choose the leg to move or the arm and the back. Getting a nice stretch through that bit. Okay, right, before I move on, has anybody got any questions about those two things that I've
Oh,
talked
I like that. I like that one.
about?
I do a similar thing around the rib cage, maybe not as gentle as you were doing it. So that's something I might try. But I like that with the leg sliding away and the arm movement. That makes a lot of sense.
Yeah, it's really nice actually, and you can also do massage, but sometimes people just they feel a little bit squeamish about that maybe. So
Yeah.
actually, abdominal massage, everybody's always really worried about it when they come to see me, and then they tell me it's the nicest thing.
Yeah, no, it's yeah. It's just that whole I think a lot of women spend so much time, as you said, just gripping and holding, and actually when it releases, they don't realize quite how much they were gripping it.
Absolutely. And stress and anxiety is a
Mm.
huge factor here. I have to
Yeah.
say, for the ladies who come and especially if they've got pelvic floor problems for what whatever the cause, there's always an emotional element to it because it's emotional. What's happening to them is emotional, but then maybe it's also perimenopausal time. Maybe it's they've got no sleep because they've got a young baby. Whatever the reason, anxiety and stress just manifests itself here, and
Yeah.
as soon as it does, it just latches onto the body, and you just cannot move. Then
Yeah.
you need to be able to move.
Yeah.
So,
Yeah, that was very cool.
okay, so next I was going to talk about C sections and hysterectomies. Just to give you a clearer idea about like looking at my tummy here, what's going on. Now I haven't had either of those, but I can give you a clearer sort of idea of what's happening so that you can picture it if you haven't either. So with a C-section, and the hysterectomy scars can come in all shapes and directions. Actually, there's quite a few different ones, and it is worth familiarising yourself with them. C-sections tend to be more the same, although there are a few different variations. But the one that I see the most is a cut, horizontal cut right on your bikini line down here, and that's where you'll see a scar. What you don't see is the vertical part of the scar, which is also there. And actually, in an op, that's what's going on. You've got 7 different layers of connective tissue, fascia, uterus to go through before you get to the baby. So all of those layers, when they heal, they're probably going to form like a sort of a ridge. They're going to probably stick to each other so things don't move around. And all of that is going to affect how your body then moves and how your pelvic floor responds to the rest of your body and what you're asking of it. So um, I find that there is a lot of restriction across the horizontal scar, deeper than just what you see. It might be just a faded line with somebody who had a C-section 25 years ago. But what's underneath will probably be a ridge. There'll be all sorts of things going on there. And there'll probably be something going on up here too. But not only that, this has been opened, this has been stretched, this has been pulled. We've had a baby come out of here. So the whole area really is fair game for restriction, scar tissue. So and you have to be really mindful of who you've got in front of you here and how they feel about their scar and what exactly is going on with them. But it's worth bearing in mind that there might be scar tissue around this area. And if there is, then there is just, even just the simplest of massage can start changing how that fascia actually behaves, how it moves, how it sort of stretches across the body, how it stretches the other way. And, you know, be curious really about what that is doing to your client and whether it would be beneficial for them to have some soft tissue work done on the area to help with all of this movement. The same thing applies for episiotomies and perineal tears, and it doesn't need to be that that's something that directly needs to you need to get hands on with, but you could. I think I might just flip back to the other view now so that I can stand up again. Hello. Yeah. With perineal scars that sort of under here, lots of different movements, lots of different stretches to open up the area and feel more less painful, less tight, less restricted. All of that would make a huge difference without anyone having to get up close and personal with internal work. That is also something that is people can explore, and they might need to, but before they do, just looking at that from a movement and stretching, perhaps using maybe a soft Pilates squidgy ball, or working up towards a foam roller or a massage ball for those areas. It's all really useful stuff to try and loosen up and get fascia moving and take out all of those really sore points that are causing a bit of restriction.
Yeah, amazing. That's what you just answered my question about using balls.
It's not something you can't just direct everybody to just go and sit on a ball, because it might just be horrendously painful from experience. Yeah. But there's ways of it's just, I think it's just really nice to explore these ideas with the client. If they are struggling, then there's so many ways that we can creatively work with them to try and change things.
I often direct people to Anna Krau's videos because she's very good at explaining it. She uses a silicon model. It kind of makes it so that it's not quite so scary. So
Yeah.
yeah, I often link up with her videos on YouTube, send those out if I'm a bit out
Definitely.
of my depth,
Yeah, absolutely.
If I'm feeling a bit scared about it, then you can actually find quite a lot of stuff on YouTube from Anna, who talks a lot about what you were just saying, really.
Yeah. I can hear my little boy crying, so I am going to bring him in to sit with us for the Q&A. Is that all right? I think he'll be fine.
Right.
He just needs to come inside.
Oh, he just wants to
Just
see
give me
you. That's
2
fine.
seconds.
Yeah, we've got some questions, so that's great.
Oscar? Oscar? Right. Come and see these nice ladies. Hi. Come on, it's all right. This is Oscar. Who's feeling a bit sad. You take a breath there, you. Right.
So,
that's it. There we go. Sorry sorry about that.
So Gemma, there's another Gemma on the call, and she's fascinated to learn more about the link between muscles, fascia, and hypopressives. How do we identify sticky area of fascia? We kind of covered a bit of this with the link between muscles, fascia, and hypopressives. But someone who isn't a soft tissue therapist, for example, who maybe comes from a fitness background and hasn't done any massage, what would you say would be a good indicator if someone was looking at a client about an area of sticky fascia?
I would be looking for really obvious clues, like have you had any surgeries? That would be number one. You know, when you're taking your history with your clients, why they're there, what they've what their body's gone through, and it might be an appendectomy or a gallbladder surgery. It might not be one of the big obvious kind of women's health ops. That would be number one. Number two is, are they in any pain? And then number three is, do they feel anything else? Any tightness or restriction or pulling? C-sections are brilliant for when but somebody's saying, well, I don't have any pain, but then, when I get out of bed in the morning, I feel a pull into my vagina, or I can feel something odd. Like, there are those kind of conversations that are worth having because they give you more pieces than just talking about the specific symptoms that might be going on with the pelvic floor.
Perfect, thank you. And Gemma also says, how do we differentiate from a trigger point?
I don't know whether I really would. I think I'd probably just be treating all of it. If I find something which feels a little bit sore, painful, then I can usually, like, you can, if you spend enough time hands-on with people, then you would feel a scar. But if it's sore and it's a trigger point, then there's something going on there with the connective tissue anyway, and it's worth calming that down, because there's a big link between, there's some really interesting blogs actually. I wonder whether I can send you a few more links.
Yeah, that would be great.
There's
You've just shared it in the trainers group.
there's a link between connective tissue and nerves, and so if a nerve is irritated for a particular reason, then the muscles around it will probably pick up on that, and because there's links between the two. Similarly, there's links between visceral organs and connective tissue, and so if you're struggling with, say, endometriosis or something like that, something more internal, then the connective tissue around that area will be picking up on it. So there's lots of the more you delve into fascia, the more you'll find. But in answer to your question, I wouldn't be ignoring a trigger point. I would be looking at that as a potential contributing factor.
Perfect. And then Matilde says, is there another part of the body we can stimulate? Example, the sole of the feet, to able to support the fascia area affected by episiotomy and tears, for instance.
Oh, what, rather than working on it directly? What I tend to do is go for movement-based stuff that does work on those areas kind of directly, or the nearby structures that connect onto the probably the pubic symphysis, especially the ischial tuberosities. So those are the bony points in the pelvis. So here's my little pelvis. We got there are muscles which, like your adductors, your inner thigh muscles that attach to the pubic symphysis here in the front, and so if your adductors are tight and your perineum is tight, they sort of go hand in hand. So what a really nice exercise that I like to give most of my clients is if you go onto all fours and then take a leg and stick it right out to the side straight. So you've got one, yeah, like sort of like a dog leg out to the side,
Yeah.
okay, on hands and knees. And then you move backwards and forwards, you just rock backwards and forwards. It's a really nice, gentle kind of stretch in and out of for the adductors. It will move the stretch in different ways and it gradually just calms the body's nervous system down into being happier, and uh, making sure that your adductors feel safe at longer lengths, and that has a knock-on effect then on the perineum and more kind of intimate areas without actually touching them. So that's a really good one. Um, yeah, I'd say that's probably my favourite go-to for.
Oh, that's an interesting one as well. I tend to do with people, I tend to do like a wide frog leg position, but
Mm.
what I found is not everyone can get into that position. So actually doing it more with one leg and then moving more around the joint probably is a little bit kinder to start with.
Yeah, yeah, that's true actually. The other one that's really good, if you go onto all fours and you do a cat cow, now
Yes.
that's really nice. But then if you also try and link it with the breath, um, and you think about moving, even though they don't move, your sitting bones don't move really. But as you're doing your cat and your cow, you can think about letting your sitting bones separate as you arch your back. You look up and you breathe in. Your pelvic floor is letting go, and you want your sitting bones to feel like they're widening, and that's a really nice kind of visual for people to connect into, to just let that kind of openness and relaxation through that part of the body kind of factor its way into what you're doing.
It's a good tip like that. And then we've got one more question, unless anybody's thought of anything and they want to madly type it in. We're pretty much on time anyway, so it's working out really well. Does tight fascia automatically mean tight muscle? Is that correct, as they go hand in hand?
Um, so, oh, that's a good question to wrap up with. I think that where the muscles actually are tight is a question that you could spend another hour discussing. The current thinking is more that muscles feel tight because of how heightened our body's nervous system is. And, when they actually look at muscles and kind of try and measure them in different ways, there isn't really such a thing as a tight muscle and a not tight muscle, but it definitely feels that way to us, doesn't it? We can tell when something feels stiff and tight, and as a massage therapist, I can feel the difference as well. Um, but I think when I see the body as a whole, and I'm thinking more about treating it and the nervous system that's sort of filling. Our nervous system is what is really kind of enlivening us, and I really want to treat people from the perspective of trying to calm all the things down that kind of are painful or sore or uncomfortable or scary or fearful. And fascia and muscle for me are then all the same, because
Yeah.
it's actually I'm working on the body's nervous system. And we're doing the same with hyperpressive. It's all about breathing and toning the body's nervous system through the vagus nerve as you move your diaphragm. And again, it's like there's loads we could talk about there, Nikki. Let's book
Oh, I know.
it.
Yeah, we need to do another one with you, Gemma. Well, we'll start to wrap it up. If has anyone got any other questions around what a fascinating topic? It's like my favorite.
It's so cool, isn't it? Honestly.
Really, and something that I write a weekly email, and I think some of you probably get it, and I've nearly always got something in there about fascia. So yeah, it's absolutely fascinating, and some really good tips there for scar release, for C-section, which I've learned something myself tonight. What I'm going to have a go at some of those things. But yeah, really, really, really good information there from Gemma. So thank you very much for doing that training for us tonight. And can you hand me back to
Yes, yes, I will.
host? That would be great. Everyone's giving you love.
No, make host. There we go. Change
Yeah.
host.
So what have we got? Thank you, thank you, thank you. Lots of thank yous. Thank you. People have really enjoyed it. That's really awesome. Thank you. How can we find Gemma online and learn more? Gemma is in the trainer group, so you can ask her any questions. If Gemma's got any other resources, then Gemma will share them with me, and or you can put them in there yourself. And obviously, this is being recorded, so once Shelley's worked her magic on it, my VA, that will be in there for you to view again and go over and practice any of the techniques that Gemma's shown you. Next month will be me and my guest, who at the beginning of this, I can't remember who it is. I'm really sorry. But I will be creating those events soon for you. Just to let you know that we did daytime training last month. And that actually worked really well. So what I think I'm going to do is do alternating. So next month will be an evening, but the month after will be daytime. So if some of you can make it through the day and some of you can make it in the evening, then there's hopefully some scope there for you to join. I'm saying all of this because people will be watching this on a recording. And I know that not everybody can make it on an evening. So yeah, that's the end of our session. Thank you everybody for joining. It's been a pleasure, Gemma. Thank you very much. I'll let you get back to your little boy and your glass of wine. Enjoy your evening, everyone, and yes, see you again soon.
Thanks, everybody.